Can genetics increase retinal damage risk? Have you ever wondered how much our genes influence our eye health? It turns out that genetics can significantly increase the risk of retinal damage. Many retinal diseases have a genetic basis, meaning that inherited mutations in specific genes can disrupt normal retinal function. This disruption can lead to degeneration and vision loss over time. Inherited retinal diseases are a group of disorders caused by mutations in over 270 different genes. These genetic changes can impair the production or function of proteins that are critical for the survival and health of retinal cells. As a result, individuals may experience progressive retinal damage and vision impairment. The severity and progression of this damage often depend on the specific gene involved and the nature of the mutation. For example, retinitis pigmentosa is a type of retinal dystrophy caused by mutations in genes like USH2A. These mutations affect the photoreceptor cells in the retina, leading to gradual vision loss. Interestingly, different genetic variants can influence when symptoms appear and how quickly the condition progresses. Another condition, Stargardt disease, is linked to mutations in the ABCA4 gene. This condition causes degeneration of the central retina, known as the macula, which affects visual acuity. Familial exudative vitreoretinopathy, or FEVR, is another genetic condition caused by mutations in genes such as FZD4 and LRP5. These genes are involved in the development of retinal blood vessels, and their disruption can lead to abnormal vascularization and subsequent retinal damage. Leber congenital amaurosis is another inherited retinal dystrophy that typically presents early in life. It is caused by mutations in genes like CRB1, leading to severe retinal degeneration. Genetic factors not only predispose individuals to retinal damage but also influence how the disease progresses and how they respond to treatment. Genetic testing can help identify specific mutations, which can aid in diagnosis and prognosis. It may also determine eligibility for gene-targeted therapies or clinical trials. In addition to inherited conditions, genetics also play a role in common diseases like glaucoma and age-related macular degeneration. While glaucoma primarily involves damage to the optic nerve, genetic predisposition can influence individual risk. For age-related macular degeneration, genetic variants in complement factor genes contribute to disease susceptibility and progression, affecting overall retinal health. Overall, genetics are a critical factor in retinal health and disease. Understanding these genetic contributions can help with early diagnosis and risk assessment. It also aids in developing personalized treatment strategies to prevent or slow down retinal damage. However, it is essential to remember that environmental and lifestyle factors also interact with genetics, influencing disease outcomes. Comprehensive eye care should include genetic counseling along with regular monitoring and management. Always consult with healthcare professionals for personalized advice regarding eye health.